Hi, it's Karol Clark here with Bariatric Business Accelerator, the quick and impactful podcast created for busy weight loss practitioners who want to systematize, simplify, and accelerate the growth of their new or existing weight loss practice. And lately, although I work a lot with private practitioners, I've been working with some health systems. And if you have a hospital bariatric program that isn't growing in the way that you expected, here's something important to remember. Demand is not necessarily the problem. Of course, obesity and metabolic disease continues to be on the rise in the US. And the real gap, what I find when I go into practices or programs, is often access, navigation, trust, and patient guidance. So there is a new patient decision journey that patients are going through. As we know, they do their homework for a long time before they ever usually take the time to reach out. And nowadays, they compare GLP-1 medications with surgery. They rely on AI search and voice assistance, and they choose providers that they trust and can easily access. They're not searching for a procedure, they're searching for relief from problems like diabetes, less joint pain, more energy, a better quality of life. We know this, but programs that talk about life transformation instead of the surgical techniques can connect much more deeply with these patients. And trust signals matter much more than ever. What they're looking for is physician credibility, real patient stories, clear education, strong reviews that are out there, and this is what will reduce their fear and help them move forward. So, why growth stalls is because most programs don't have a marketing problem, they have sort of a friction problem. Patients tend to drop off during that process, especially if response times are slow, if the insurance steps feel confusing and we don't clarify that for them, if every next step isn't clear, if no one is personally guiding them through that process, if they can't easily see how to begin and how to move through the process, they're going to choose a more accessible provider. Internal misalignment between leadership, marketing, and clinical teams can also slow growth even more, which is very common in large health systems. And while digital search is evolving quickly, referral relationships still are powerful, especially when surgery is positioned as a chronic disease treatment rather than just the procedure. So, what will help move the needle are some quick wins. And the good news is that you don't have to have a huge budget to improve your growth. What you need to do is make it easier for your patients to start and have a clear start your journey pathway here and simple next steps. Respond quicker to those inquiries. Make sure that you have same day contact and a patient navigator. Those make a huge difference. You want to build trust with them. So, you want to have your physicians out there in videos, show patient stories, and have active management review. And you want to show up in the search. So you want to be answering common questions and publish health condition-based education and track conversion metrics so you can identify where patients are disengaging. If you remove this friction, it improves both the patient experience and it will improve your surgical volume. So if you take one action this week, make it this: walk through your program as if you were the patient. Are you easy to find when you're doing AI searches or voice searches? Is it easy to understand the very next step? Is it easy to get started? Because the programs that win today aren't the ones with the biggest, that are the biggest and have the biggest budgets. They're the ones that can make care easier to access, easier for them to trust, the patients to trust you, and easier to get started. And I find this happens particularly in large organizations because perhaps there is a disconnect between marketing and the physicians and the health systems. And there's a lot of rules that are put into place that help prevent you from being found or having your website easy to navigate. We've got to break through that for these large health systems so that you can be nimble on your feet just like private practitioners are. And so if you want help with this, I would love to be of assistance. I do a lot of complimentary introductory calls with different practitioners or programs. I'm also out doing talks here and there, and so I also talk with a lot of different program owners while I'm out and about. But you can always reach out to me, Karol, Karol, at weightlosspracticebuilder.com. And while I don't always have all the answers, I'm a fresh perspective and objective viewpoint of your patient pathway. And I do encourage you to look at your pathway from start to finish. It has a lot of gold nuggets in there that really can help improve conversion and help to grow your program. I know volumes have been stagnant, they were down, that sort of thing. But if you put these steps into place, it can really be impactful so that you can stand out as the choice in your community for weight loss surgery. So I hope this was helpful. And like I say, reach out to me. If you can share this with any colleagues, that would be great as well. And always remember to subscribe. Take care.